let's get to it. Dr. Seran,
Absolutely.
hi. Let me
Hi.
reintroduce you. Hi. Or why don't you introduce yourself? Who are you?
Um, my name is Seran. I am the mother of three not so newborns anymore, teenagers now. And I'm also an emergency physician. And most importantly, I think around here, I am everyone's driver. So the story actually of 3MD, as you mentioned, so 3MD or Three Mommy Doctors was started by three emergency physician moms, myself included. We met during residency and had kids pretty early on in our careers. We trained at LA County Hospital, which is a level 1 urban trauma center. And it's actually where a lot of the military medics, before they're deployed overseas, spend some time training as well. So it's the closest thing we have in the US to warfare. So it was our own sort of little warfare working in the emergency department during long 12-hour shifts in highly stressful environments. And so needless to say, we bonded very quickly. Between the three of us, we have 11 children, 10 of whom are boys. So after residency, we would call each other up after our shifts in the middle of the night, and when we couldn't go to sleep, and we would talk about our crazy families and kids, and we would also talk about the cases that we would see in the ED. And many times there were cases, parents, our fellow parents, bringing in their children that, if they only had the right tools and the right information, could perhaps have avoided an ED visit altogether. And so this was how the idea of 3MD was born. It came out of necessity for a product that didn't exist. And so we wanted evidence-based medical information along with hospital-grade products. And this is what we wanted as parents. As emergency physicians, the number one question we would always be asked was, when do you need to go to the ER? And so, we wanted to include red flag symptoms so that you could navigate when, you could tackle this on your own, or when you needed to see your pediatrician, or when you needed to actually head directly to the ED. And so our goal was to put all of this into one kit to empower families during a highly stressful, high anxiety producing times, because we've been there, we know what it's like. And so now with this amazing collaboration with Babylist taking over our passion project, we can actually just concentrate on being doctors and moms.
I love that. So to be clear, Dr. Seran and her partners made a first aid kit that was the precursor to this Babylist first aid kit. And yes, now the Babylist first aid kit, powered by the advice and recommendations of Dr. Kim and her partners, is available in the Babylist store, $79.99. It's a higher price than typical first aid kits for good reason. There's a lot of juicy stuff in here. It's not just, the typical 10, 15 piece kit that you'd find with most kits, but it's got, I'm not going to do a full unboxing, because if you want to see an unboxing, we have one in our IG live section, so you can look at that. But if you open this kit up, there's two sides to it. There's a mend and a tend. Mend is all the kind of the first aid-y type things that you would expect in a first aid kit. Tend is like, this is all the stuff that's saving you from those late night runs to Walgreens, CVS. We've got pacifiers, teething rings, combs, cradle cap stuff, baby oil, like tons and tons of good stuff. Tons is a little bit overselling it, but lots of good stuff that new parents definitely need, but might not anticipate that they need right away. And it's always just like, oh, you know, she just broke her first tooth and, you know, she's complaining of pain and I don't have like the right, you know, I don't have a teether yet or all that stuff. So just a really nice, really robust first aid kit full of also information like Dr. Seran was saying, what, you know, something happened. What should I do? Should I tend to this myself? Should I go to the ER? We've got, you know, what to do in case of fever, nasal suction, how to administer CPR, although that's not super detailed because you should take a CPR class. What are common rashes? What do I do about cradle cap? All kinds of stuff on the box and in the box to get you what you need. So only in the Babylist store. Thank you so much, Dr. Seran, for really putting your heart and soul into helping us bringing the 3MD kit to life and then helping us bring the Babylist kit to life.
Oh my gosh, thank you.
The name of the kit is basically Babylist Baby First Aid Kit for those asking. So, but what we're really here for is to talk about an ER doc that's seen it all. If you were going to welcome a baby into your home for the first time, what are the things you would do to prepare your home? I think this is such juicy information. So let's get right to it. We have a 10-point checklist.
All right.
And the first is remove all pillows, blankets, stuffed animals, and toys from your crib, including crib bumpers. Wah, wah, such a bummer. I see so many beautiful nurseries.
Absolutely.
So much beautiful bedding. Tell me about why this is important.
So all of that cute, fluffy, soft, warm stuff, I actually label jokingly as RFM, which is really for mom, because all of that stuff increases your risk of SIDS. And SIDS stands for sudden infant death syndrome, and it is the unexplained death of an otherwise healthy baby under the year of 1 year. And this usually happens during sleep. And although the exact mechanism is not for certain, is unknown, we do suspect that it is from either an immature or a faulty brain, the ability of the brain to arouse from sleep and breathing control centers. And so it's really, really important to keep all that stuff out of the crib.
Because that could block, the baby could, you know, move their mouth to it or roll into it.
So, yeah, crib bumpers in particular were designed, crib bumpers were designed to protect babies from rolling around and hitting their heads on the crib slats or getting their heads stuck in between the crib slats. Safety precautions and measures have been made so that cribs are no longer made. It's virtually impossible to stick your head, a baby's head, in between because they're so much closer together. And so baby blankets as well pose a big risk because, yes, they can flop on a baby's face and suffocate your baby. And so none of those should be used. Pillows included, pillows. Babies should actually lay flat on their backs on a firm surface without any pillows. And so because of all these measures in place and education, the SIDS rate has actually gone down over the years, but it still remains the third highest reason for mortality, infant mortality. So remember, it's very important. Back to sleep. To sleep.
No blankets. What if your baby gets cold?
No blankets. So use a sleep sack, or you can swaddle, but absolutely same reason. Do not use blankets.
Got it. Okay. That was hot tip number 1. Tip 2, ensure that all smoke detectors are functional. What rooms need smoke alarms?
Every room, every bedroom needs a smoke alarm. Smoke alarms are so essential to preventing fire deaths and fire injuries. And 3 out of every 5 homes actually, or 3 out of every 5 home fire deaths are actually attributed to a defaulty or lack of a smoke alarm. So it's super important and such a simple lifesaver to make sure that these are installed and that the batteries are checked regularly.
Okay. What are some good ways? What does regularly mean? How often do you need to check batteries? What are some good ways to remember to check batteries?
Yeah, so once or twice a year is usually what's recommended. And some people think when they, change their clocks, change their batteries. I personally use the every day on my birthday or every year on my birthday. Well, there's a lot of things that I do on my birthday, including remember that annual gyne exam.
Yeah.
So happy birthday. Very important to do, and you won't forget. But smoke alarms themselves actually should be changed about every 10 years. And so don't forget to keep that reminder. And also, while we're on the topic, you should make sure that you have a good fire evacuation plan for your family in the event of a fire.
Got it. Great. Question came in. Are those flathead pillows okay to put in the crib?
Nothing. Nothing. Sorry.
So flatheads are fine.
Oh, you mean for the recommended ones to prevent the baby's head from being misshapen? Is that what
I mean, is there such a thing as a safe flat pillow that prevents?
No, unless it's recommended by your pediatrician, I would put nothing in that crib for a newborn.
Okay.
Yes.
Okay. Cool. Well, that saves a ton of money, I guess.
I know. They're so cute. I agree. It's an RFM thing. It's an RFM thing.
Yeah. At what point should you feel more comfortable with baby having a blanket? Is there, I mean, like my 4-year-old sleeps with blankets. Like,
yes, I think 4 years old, but the newborn stage. No, I'm just teasing.
Okay.
Yes. No, when they can properly lift their head and move around, you know, at the newborn stage, there should be nothing in the crib.
Okay. Pacifiers?
See, that is actually that's a whole other hot topic that we can actually spend a whole other thing discussing is the use of pacifiers. But pacifiers, if your baby needs that to soothe, but once again, they shouldn't fall asleep with it in their mouth.
Got it. Okay, cool.
Okay.
All right. Sorry, that number one was...
I know. Cute stuff.
Okay, tip 3, make sure all carbon monoxide detectors are functional. Tell us what carbon monoxide is and like where it comes from.
Right. So carbon monoxide is actually a colorless, odorless gas that can cause permanent brain injury or even death in even very small quantities. It's a byproduct of burning carbon fuel. So think, your natural gas stove or the gasoline emissions from your car. And because it's odorless and because you can't see it, it can be very, very dangerous. Early symptoms of carbon monoxide poisoning can be if you're feeling dull headache, weakness, fatigue. You can start having nausea, vomiting, eventually shortness of breath, confusion, loss of consciousness. And so it's a very insidious and very dangerous poisoning.
Yikes. Yeah, the colorless, odorless is definitely the scare factor. So in terms of carbon monoxide detectors, I think you can buy them at any Home Depot, Walmart, wherever. Where should we put these? How many do we need? Is this same as smoke detector every room?
Right. Well, so definitely you want to have them in every bedroom. And similar to smoke detectors, you want to check the batteries and make sure they're functional. Carbon monoxide is actually lighter than air, so ideally you want to place these at least 5 feet above the ground or on the ceiling. But I know that a lot of carbon monoxide detectors are plug-in, and so not a lot of people have plugs 5 feet high. So just something to think about. But yes, you definitely need one in every room and every floor if you do live in a multi-story home.
Yeah. And if you're starting from scratch, they've got smoke, carbon monoxide combo detectors.
Combos, yes.
Yeah.
And the other point that I want to bring up with carbon monoxide, especially, it's particularly dangerous for pregnant women because carbon monoxide binds very tightly to fetal red blood cells. And so the carbon monoxide, if you are pregnant and do get poisoned, it actually gets shunted to your fetus, your unborn fetus, more readily. So it's even more dangerous for pregnant women in terms of carbon monoxide poisoning.
I feel everybody throwing their windows open right now. Okay, I'm sitting next to my stove. I'm going to throw open my windows. Okay. But we have carbon monoxide detectors, so we're okay. So, okay. Thanks for that safety check, and good to know about pregnant people. Your fourth recommendation is to research the safety of baby items like cribs and mattresses. How do we go about doing the research here?
Yeah, so there's a it's called the Consumer Product Safety Commission, and it's actually an independent, federally regulated agency whose sole job it is to research consumer products for safety and decrease any injury or death from consumer products. And they have a fairly easy to navigate website with an actual tab wholly dedicated to recalls. And so you can double check all of your baby gear to make sure that there have been no safety questions or recalls. And if you receive any hand-me-downs, which are obviously amazing and encouraged, it's always great to double check that those have not since been recalled as well.
Right. Yeah. So, and this is like great advice that if you didn't, if you bought something new and you get those little postcard, most baby products have little postcards in them saying like, register your product. And you're like, I don't want to do that. Do it, because then you get a phone call or an email or whatever contact you provide that says, you know, something's been recalled. Our car seat was just recalled. We've had it for 4 years. And if I didn't, work for Babylist, but also I got an email from the manufacturer that let me know that there's a voluntary recall.
Oh, wow.
Which if I didn't register my product, I would have been none the wiser. So it's really to do all those things. Yep.
Yeah, so I see here, sorry, I just see here, the website is cpsc.gov, www.cpsc.gov. So that's a good one to have. I keep seeing that pop up.
Yeah, super easy. And you can sign up. They actually have great newsletters too that you can check off, like what products are you most interested in seeing recalls. So I get a once a week roundup of all the recalls that happened.
Absolutely.
Another nice way to passively monitor recalls.
Right.
So sign up for their CPSC's newsletters too.
Correct.
Question. So you're also saying like you mentioned crib bumpers. If these products are unsafe, why are they even being sold? Like, shouldn't they be illegal? What's the deal?
Right. So the U.S. Consumer Products Agency or Commission, actually, their sole job is to continually check products, even if they're older. And so it might have been approved for your older child, or you receive it, you know, at a secondhand store or as a hand-me-down, and it was approved back then, but years later, they can also be recalled. So again, good point. You can sign up for their newsletter and specifically request to be aware of any baby safety recalls. And so,
yeah. And I mean, it's kind of a little bit of a sad fact, I guess, that just because a baby product is on the market doesn't necessarily mean it's safe.
Correct.
There's no real, unless there's like specific legislation that goes through on that specific product, like most people are allowed to like make unsafe products and sell them. It is what it is. So I'm thinking of like, I've seen quite a few bath seats. So there's like a seat that you can plop your baby in the bath, and it helps your baby sit upright. Most of those, I think Summer Infant produces an actual a bath seat that was approved by JPMA, but all the other bath seats that I just see on Amazon or whatever, those have not been approved for safety. So
Right.
do your due diligence on iffy products like that. It's kind of up to
Absolutely. And on that note, I mean, you never want to leave a baby unattended in any sort of water situation, as babies can drown in as little as 1 to 2 inches of water, and they can drown very quickly and silently. And so never leave a child, a baby, a newborn unattended, even for a second, in the water.
Yeah. That's a good segue to, I'm going to flip-flop a couple of the points. You say keep your water heater at home at 120 degrees Fahrenheit. Why is that?
Right. So hot water scalds are the #1 cause of burn injury in infants. And so prevention is the key, and decreasing your maximum temperature of your home water heater to 120 degrees Fahrenheit actually can prevent a lot of those burn injuries. And so on that note, though, you should always check the water before you do place your baby in the bath. Check the temperature. And as I said again, like, do not leave a baby unattended, because they can drown very quickly, especially newborns. And so
Aside, go ahead.
No, I was just thinking of a personal anecdote as well. And when you're in line for a much needed hot latte or hot tea, and you have your baby strapped to you in a carrier in the front, spills may happen. Not that I may or may not know of someone this happened to. He's fine now, but it happened.
Yikes. That's a good one. I know there's, like, fancy tubs and water thermometers and all that stuff out there, but new parents we want to balance I don't want my baby to be too cold, but I want the water to be safe for warmth. What is there, like, a good guide, just like from hand touch or whatever, to know, hey, this is too hot? Like, using your own body, is it possible for you to tell whether what does too hot mean for a baby?
Right. Well, that is very subjective. It's very cultural too, actually, what temperature water is best. Obviously, if you have your hot water heater set lower, if it's under 120, then the severity of you can't, under a 120, you can't burn with a scald burn. However, hand touching, a lot of times what I feel is hot and what my husband feels is hot is very different, and people have different ranges of what that hot is, especially with your hand.
Yeah.
And so I would highly recommend just using a actual bath temperature, just to keep it, consistent between family members, and also to actually know what is hot.
Got it. Okay. Okay, that sounds good. So use an actual temperature gauge.
That's what is recommended before you put your baby in the water. Mm-hmm.
And anything is cool under 120? That sounds hot still. Like,
it does seem hot. So no, I'm not saying that. I'm just saying that you won't severely burn your child. Again, it's a very subjective thing. I think worst case scenario as an emergency physician, but no, I will admit that I can't even remember the temperature that we had in the bath for my little ones when they were small. So,
all right. Well, body temperature is 98.
Correct. And that fluctuates a little bit, but yes, that is what we consider.
Is that a good temperature for, like, if you're like, oh, I want to regulate my baby's body temperature? I keep digging you on this question. I want a number.
I'm going to go over there and check your water heater. No, 98 is great. 98 is great, as a pool temperature as well, because that's what my kids they refuse to go into any water less than 90. So, but again, subjective. I'm not gonna.
Okay.
I can't tell people what temperature
Okay.
to put their kids at.
I'm appreciating my own investigative journalism skills here. I really wanted you to say a number. So. Okay. How about another tip? We're skipping back to number 5. Keep an emergency list of phone numbers. In this day and age of like digital,
Right.
You know, I haven't written down a phone number in so long. Tell me what does this mean specifically? Where does this emergency list live? Who needs access to it?
Right. So important numbers to have, and there is a great card in actually the baby list kit, is your personal emergency contacts, your pediatrician, poison control, and you want these written down in case you have caretakers such as grandparents or a babysitter who spends the night with your baby, just handy in a centralized place so that you know and everyone knows where to find it. In the event of an environmental emergency, cell phones service can be very spotty. So landlines also are, even though they sound so archaic, is the gold standard. So make sure you have a landline, write out the numbers. And another number that I actually think is also important, especially for new moms. So there's a thing called the baby blues, which is completely normal for new moms to have anxiety, loneliness, sadness. It's definitely hormonal mediated. There's a lot of stuff going on after you have a baby. And this can progress to something called postpartum depression. And postpartum depression does not go away on its own. And so the number that is important is to the National Suicide Prevention Hotline. And that number is 1-800-273-TALK. And so like the poison control line, this number is staffed 24/7, all day, every day, and it's free and completely confidential. So it's a good thing to have. You never, all these numbers are something that you never want to use, but you have in case you need. So that's a good reminder to have that very important both of those, poison control and the suicide hotline.
Yes. You mentioned landline. Is this true that 911, if you call 911 from a cell phone, they can't locate you? Or
Correct.
They can better locate you from a landline?
Right. So cell phones, first of all, in the event of a true environmental emergency, are spotty. So yes, and many people like I, who still has a Chicago cell phone number, yes, they oftentimes cannot, it takes time for them to reach your location via cell. Versus a landline, it's pretty immediately. They know your exact location quickly. And so that is also recommended when you do call 911 to call from a landline for more expedited care.
Okay, good to know. Let's talk about pets. If you have a pet, why is it important to prepare your pet, and how can we do that?
Yeah, so to help prepare your pets, when we're mostly talking, your 4-legged furry babies, you can practice diapering, feeding, rocking a doll, put one in a stroller to take a walk, to just get your pet accustomed to all of these new activities. And you can actually put them in a class as well if you're concerned, and that actually, if you do it in advance, will give you some time to recorrect or redirect any behaviors that you find that were not there previously. Other things people suggest are talking to your pet with your baby's name if it's already chosen. But again, if you have any hesitation regarding having a newborn in the presence of your pet, I would highly recommend discussing this with your veterinarian.
Got it.
Yeah.
I see a lot of random TikTok videos of cats trying to smother babies. Like, keep that nursery door closed, I guess. There's like cats that are just sitting on babies' faces, and oh my gosh. So that's a real thing.
Yeah. Well,
Yeah.
cats actually bring up a whole other discussion. Cats in particular and pregnant women. That brings up some special considerations. So when you're pregnant, do not befriend the neighborhood cats. Do not bring a new kitten or cat home for adoption while you're pregnant. And if you do have a cat, make sure that you change the litter box daily. If possible, have it done by someone other than the pregnant mom, because of something called toxoplasmosis. And toxo is a parasitic infection that can actually, that's actually shed through the litter box, that can cause liver swelling. It can cause, it can cause blindness, birth defects. And so something to keep on your radar, when you have cats and you are a pregnant mother. Yeah.
So are people usually not susceptible to toxoplasmosis when they're not pregnant? Or if you get it when you're not pregnant, it's not a big deal? Or what's the deal on that?
I mean, it's still possible to transmit toxoplasmosis if you're not pregnant. It's just even highly more dangerous because of the risk for miscarriage and birth defects. So that's why we highlight that with pregnant moms. And as with dogs, you want to make sure that you acclimate your pets to a new baby. So you can take baby lotion and before you pet your cat or dog, or play sounds of babies crying or babies cooing, just so that they're acclimated to a new baby. And they need time to adjust as well. So if you are, and I highly recommend if you have a dog especially, to maybe if you are the primary dog or cat taker, to relinquish those duties onto somebody else, and make sure that you do that far enough advance that it's not such a big crazy world upturn.
Yeah.
Incident.
I love that. That was a great tip. Baby lotion. I hadn't heard that before. That's really smart. Okay, let's move on to properly installing your car seat. Easier said than done. Tell us why car seat installation is so essential and how to make sure that you get the right installation.
Absolutely. We have a saying in the ER, in the ED, that babies are not just small adults. And this is because they have larger heads, they have, different spinal anatomy. And so they are more prone to fatalities and severe injuries during car collisions. And so that's why it's so important to have car seats installed properly. And there are, newborns should be placed always in the rear facing in the back seat. And if you have a convertible car seat, you just want to make sure that it is approved for wee little ones, newborns. You can always go on the website for the National Highway Traffic Safety Administration. And so they actually have, you can type in your address and it'll pop up with free checkpoint stations where you can go in and make sure, from an accredited car safety technician, to make sure that these are installed correctly before you bring your baby home.
Okay, awesome. I just dropped the main page of the National Highway Traffic Safety Administration and NHTSA.gov. The full address is NHTSA.gov/equipment/car seats and booster seats. I'm sure if you just go to the website and Google or enter in the search car seats, booster seats, it'll come up for you. So Yes,
Great.
I think it's a common myth that you can just roll up to a fire station and be like, check my seat. And
That is
the
true.
fire people will be like, no, you check your seat. So there's a great list. There's ways to find approved car seat technicians. There's a longer name for them, CPST. I forget what it is. So sorry. Approved technicians that are trained to check your car seat.
Correct. Yeah.
Okay. Take a CPR class.
Yes. So CPR stands for cardiopulmonary resuscitation. It's one of those skills that you never hope to use, but is so vital because bystander CPR, or that which is done before medics or EMS, emergency medical services, gets to you, can increase survival 2 to 3 times. So super important to take a class. And there are many ways to do that these days. There's contactless, you can take them online. In fact, the AAP, or the American Academy of Pediatrics, actually has a kit that you can order that includes a mannequin where you can practice. And so many different options. And there are actually many different protocols as well. We as emergency physicians tend to follow the American Heart Association protocols. However, the American Red Cross has some. YMCAs actually offer a different method, and your local hospitals. So there are many resources to be able to take a CPR class, both adult and child and infant CPR.
Awesome. And we have a great doctor approved guide to CPR, infant CPR classes that I will add to our Instagram stories after this, so you can see what's available to you and decide what kind of class works for you. Virtual, online, order a kit, whatever. But just, there's so many ways to do it, so obviously please do it. So I'll make sure that that's in our links.
Absolutely, because the life you save could very well be one of someone of your loved one. So super important.
For sure. And here we are, number 10, stock your medicine cabinet or first aid kit. What does a well-stocked medicine cabinet first aid kit look like? As I've totally blown up my kit.
I am a little partial. There are obviously things that you want to keep inside your home before any quote unquote emergency occurs, because needless to say, they always occur when your pediatrician's office is closed, when the pharmacy is closed, in the middle of the night. So, yes. So there are a couple things. One of them is simethicone, and simethicone is a very well-tolerated medication that we give for gas, which is also a very common ailment of infants. It's generally given in 20 milligram doses. You can give it up to 4 times a day, every day. Low side effect profile, but again, I would confirm this with the dosage that's written on the packaging. In addition, always
I'm sorry, the simethicone, is there like you know how acetaminophen is Tylenol? Is simethicone more commonly known as something else, or like do I just go to Target and get simethicone?
Yeah, they have a different brand names for it. Milacon is one that that I can think of offhand. But yes, that is the generic name for it. And again, it's a commonly given medication. So, you know, if you do have gas, it's something that you can try. There are a lot of actual techniques to prevent gas that are non-medication routes. So again, lots of options, but something to consider. In addition, I just want to make sure that people know that whatever, especially for any liquid medication, you should always use the dropper that's in there. Because the dropper is specifically designed to give the correct dosage. So don't go switching medical droppers or applications for liquid medications.
That's included.
Yes, that's with the medication. Yeah.
Okay, great. One thing to note, the Babylist first aid kit does not include simethicone, but so that's a great one to buy and keep in your medicine cabinet. Yeah?
Yeah, yeah. If your baby does
Okay.
truly have gas, it's a good thing to keep in there.
Okay.
Another thing that you should probably keep stocked as well are vitamin D drops. So
Okay.
vitamin D for babies, no matter if they are breastfed or if they are formula fed, even though formula is fortified with vitamin D, all newborns within the first few days of life do need vitamin D supplementation with 400 international units of vitamin D.
Okay.
So you don't run out of that.
Okay.
Have that stocked.
Got it. And you can get that at the CVS, Walgreens,
Correct.
anywhere.
All
Everybody has
drugstores.
it.
Yes.
Okay. Cool. Great.
And then another thing that I do think is imperative to keep at home is acetaminophen, which is also known as Tylenol. So we use acetaminophen for a range of things from fever to, to teething and pain. And it is a weight based dosage medicine. So
Okay.
it's very important to give it weight based to be effective, as my 4-month-old was never the size of other people's 4-month-old. And so it's really important to make sure that you do it by weight. And now that I'm on this, yes, included.
Yes.
And while I'm thinking of this, ibuprofen, which is also known as Motrin, even though it's a great anti-inflammatory, should never be given to infants less than 6 months old. Ibuprofen can actually cause severe GI side effects, gastrointestinal side effects, as well as can cause renal failure or something called Ray's syndrome, which can lead to liver and brain swelling and even death. So no Motrin for 6 months and younger. Keep that in your pharmacy for the older kids.
Dropping simethicone in there, so people are asking for the how to spell that. So
yes.
Okay, perfect. Infant Tylenol included in the baby list. First aid kit and also dosing chart, which is really handy because your baby keeps growing. So it's like every time you need to give infant Tylenol, which is hopefully not that often, your baby keeps growing. So you're like, what is it now? So it goes by weight. Really handy, right in the kit.
And a reminder to never give Motrin before 6 months. So that's listed on there.
Never give Motrin.
Yes.
One question that came in before this live was, are there any natural substitutes for Tylenol?
Yeah, so there are homeopathic and naturopathic substitutes that are on the market. I highly do not recommend giving those to a newborn because several reasons. One, they're not FDA approved. They're not FDA regulated. So anyone can put out a quote unquote homeopathic, naturopathic supplement on the market. Number two, these are not, we don't know the actual concentrate of the active ingredient of whatever naturopathic is out there. And especially because they're not FDA regulated, they can say one thing on the package, but in actuality, it is a different dose. And lastly, none of these have been extensively studied in newborns. And so I would just try to omit that category for application in terms of newborn babies.
Okay.
Yeah.
Good to know. What else? Fever. What would you do for baby fever? Yeah.
Yes. So fever is a big one. Well, first of all, fever for a newborn is defined as 100.4 degrees Fahrenheit. And that we check with a rectal temperature.
Okay.
So again, in this
So
kit,
that information you don't have to remember because it's in the Babylist kit. It says what is the fever, and then it gives you the info right on the box.
right.
And then, sorry to interrupt you.
No.
You got your rectal thermometer right in the kit, and some lube. So you don't, so
Correct.
be nice to your baby. Put some lube on that.
And instructions on how to do a proper rectal temperature. So
okay.
Again, the temporal thermometers are the ones on the forehead, or the tympanic ones, the ones that go in the ear, are not effective or accurate in newborns. So for babies under 3 months old, we always check rectally.
Okay.
So yes, fever 100.4 degrees Fahrenheit, and any 6-week-old or less with a temperature, actually 12 weeks, less than 12-week-old with a temperature of 100.4 or greater needs to go straight to the ER. This is an emergency. So yeah, so big highlighted thing there, you know, and that again, also that number is listed in there for reference.
Why does it become less and less of an emergency? Like, my 4-year-old has a 100-degree temperature and nobody cares. Like, what is why as they get older, is it less and less of a drop everything, go to the ER?
So newborns tend to have a very immature immune system, right? They're still reliant on antibodies that they received, maternal antibodies from mom that they received during pregnancy, and can be continued on after birth with breastfeeding. We just don't know how long these antibodies last for. And so that's what makes them so prone to infection and life-threatening sepsis at such a young age. So yes, once they grow older, they have more mature immune systems and can handle it on their own. But for the little ones, it's a very big deal.
Yeah. I'm sorry, I can't see. Malia. Yeah, SARS-CoV-2, absolutely. Fever, fever for COVID. Yep, we're all keeping an eye on that. So rectal thermometer for the newest babies is the important thing to have.
Right.
Okay. Talk to us about rash.
Yeah, so one thing you should have in the kit as well is a zinc oxide based cream. And so these actually can help with a variety of rashes, including the most common, which is diaper rash. And what zinc oxide does is it provides a barrier against moisture. And so that really helps expedite healing. I love it. I wish you could smell that.
I feel like a makeup influencer. I'm a makeup influencer.
It smells so good.
Oh, it actually does.
Yeah.
It does smell nice. Yeah. Yeah. So a nice like physical barrier between moisture.
You can see the barrier. Right.
Yes. Yeah. Okay. So this is for diaper. What if they have a rash on their face or their elbows, or in those little fat creases?
Right.
Do you use this?
Yes, a lot of those can be treated with Phytoplex or any zinc oxide based cream.
Okay.
But again, if there's a rash that persists or something else is going on that you suspect, something that you definitely want to bring up with your doctor.
Okay. What does persist mean? How many days before you go, I gotta call my doctor?
I mean, it depends on the rash. If it literally is something that is affecting their feeding, or they're cranky, or you can tell this is not right, I would immediately contact your doctor. If it's something that you think that is diaper rash, or even, babies have a lot of fat rolls, if you're lucky. And so a lot of times, you can, if you clean out in between those rolls and put some cream on, and the rash goes away in a day or so, then again, non-emergent. But any concerns you have, definitely bring up with your doctor. And if we could do a whole thing on just rash, I have a lot of things to say.
If you want to see a whole live on rashes, put it in the comments and we'll see. We'll gauge the interest. Let's talk about congestion. What do you do for nose, throat congestion? Right. Super common.
So the another thing you want to have in a kit is a nasal bulb with some saline spray, and this is because that helps clear out the mucus in a baby's nose. And when done right, can be very effective. So mucus actually traps debris and invaders, viruses in your baby's nose, pollutants. And so since their lungs are maturing, they don't have the ability to expel this mucus. So mild congestion is actually very common in babies. And they are what we call nasal obligate nasal breathers. And so they breathe through their noses. So when they're congested, they can't eat very well, they can't sleep very well, and frankly, neither can you. So proper suctioning of the congestion helps solve this and makes everyone happier.
Yeah.
So must have.
Love that. Okay, great. I think that's the list that you have mentioned. Of course, there's also there's gauze. Why aren't there BandAids in here? Why wouldn't you use BandAids? Why is there gauze in these for babies?
Yes. So we don't use BandAids ever in babies. They can cause a tourniquet if you put it on too tightly. And B, they are a choking hazard. So BandAids in newborns are a big no-no.
Okay.
Yeah.
No go for newborns.
Correct.
Save for later in life.
Right. Absolutely.
Okay. Great. And yeah, we didn't really cover the 10 side, which is a bunch of like
RFM.
Nice to have. These aren't like health emergent situations. These
Correct.
Are like I'm really thankful to have nail scissors, there's a baby's first toothbrush that goes on your finger, brushes and combs, all kinds of stuff that you will need. And the nice thing about the Babylist kit is like these are really good brands. This is Green Sprouts. It's not just like other first aid kits are kind of like here's a random plastic whatever. We have actually put in brand name nice pacifiers, things you need, things you might want or need for your baby. I love this Nano Baby pacifier, so sweet. And first toothbrush from Green Sprout. So a bunch of other things in there. Okay, guess what? It's been an hour.
Awesome.
Yeah,
Thank you.
We did it.
Yay.
Thank you so much for your expertise, for lending us all of your expertise to a bunch of our new first aid guides that we are going to pin to our, I can never remember what it's called, Instagram stories highlights. Too many social media things. So Dr. Seran has either written or approved all of our Babylist first aid content. So it's a little bit of homework for you, but if you are expecting our new parent, we highly suggest that you, after this live, we'll post them to our highlights, read through all of our first aid content. It will give you peace of mind in case of emergency, and it has been approved by one of the best in the biz, Dr. Sarah.
Oh. Thank you, Kathleen. Truly.
Thank you so much. This was super fun.
I know.
I mean, it's like a hard topics to talk about, but you're just a great person to talk about them with.
I've got tons of crazy stories. Yes.
Yeah.
So,
yeah.
Again. All right. Yeah. Well, thank you so much.
Thank you. If you have any topics that you want to see Dr. Seran cover with us in the future, DM us, and we'll plan something again.
Sounds great. All right.
Thank you
Take
so
care,
much.
everyone.
Bye.
Bye.